A lot has changed. Our volumes have changed. They've decreased tremendously due to COVID and parents just not bringing their kids in fear that they're going to expose somebody to the virus. Our PPE requirements have changed. We are having to don much more PPE for every single patient, not knowing in the emergency department on arrival if they're positive or negative. And with this virus, the symptoms are such a wide range that you just don't have any clue if the patient you're dealing with is COVID positive or not. So to keep our employees and staff safe, everyone's COVID positive until proven otherwise.
The biggest change is just kind of how we interact and react with families to, obviously the PPE that we have to put on with every patient encounter. So it's just the challenge of how you do things. You have a flow of how you go, and you go into a room and you interact with families, and that's just been completely changed.
In the winter, we usually see our volumes increase almost double. In the last few flu seasons, we've seen some pretty sick kids, and our numbers get to the 3s, 4s, sometimes even the 500s. And when COVID first started, we were seeing in the 100s, maybe 200s, but we're seeing so many more kids that have required so much more attention, sometimes 2 nurses for 1 patient if the child is very sick.
Our psychiatric population's really increased, and so it's requiring 1-to-1 on those psychiatric kids. They have to have 1-to-1 monitoring to keep them safe. And so that is, although our volume's down, it's taking more nurses to care for what we're seeing at this time.
Our incidence of child abuse has been one of the biggest things that we've seen through COVID. Kids are being left home alone or with people that aren't reliable. Parents have still had to work to try to earn a living, and the kids have suffered from that.
We're still seeing an increased number of kids who are coming in with injuries as a result of just the stress levels at home. I think with everyone being at home, the kids are home, we are definitely, there's a stress level that I understand having my own 3 kids.
Parents are struggling. I mean, some people haven't worked in a long time, which causes stressors on the home life, which causes people to hurt their children.
Being a nurse in the ER during COVID is frightening and exhilarating at the same time. You know that what you're doing is truly making a difference. And I feel that the community has done so much in honoring us and really recognizing the position that we are in, the unique position, but then showing their appreciation. I mean, we've had people in sidewalk chalk put messages out there for us as we're on our way to work in the morning and walking in the doors. And it has been, their love for us has been felt.
What keeps me going? So my love for this organization and my love for kids. That's what keeps me going. My staff is awesome, and so is my management team. And I don't ask them to do anything that I wouldn't do, and they know that. And so it keeps me going to see the drive that they've had through all of this. They just figure it out, which is amazing. There's not a lot of complaining. Everyone still has smiles on their faces when you can see their faces. And so it just keeps me going knowing that they are trying to keep the promise that we made to the kids in our community, which is to take care of them. And they do that every day.